Good afternoon, everyone. This is Cyril Dave Guillermo from BSN3C, and I am from the 4th group together with my group mates, Mr. Alan Briggs Guting, as well as Miss Eliela Christine Mateo, Miss Jorfeline Medrano, and Mr. Glenn Lord Pacada. So we will be going to discuss our group presentation. The Unit 12 focuses on the geriatric healthcare teams. So first, we need to define what is the geriatric care and its significance. So according to MOG 2010, the geriatric care is usually consists of a team-based approach. This care team can include but is not limited to a geriatrician, nurse gerontologist, case manager, physical therapist, occupational therapist, and speech therapist. So this team focuses on evaluating medical, social, and emotional needs with special emphasis on common problems in older adults such as memory problems, falls, incontinence, and multiple medications. So the ultimate goal of this care team is to help older adults age gracefully. So let's move on for the lesson proper. For the geriatrician is a primary care physician who specializes in treating conditions that affect older adults. The approach tends to be holistic and involves a multidisciplinary team, and the geriatrician concentrates on managing the medical conditions which affects the patient. The geriatricians diagnose and treat a wide range of conditions and diseases that affect the people as they age, including the dementia, osteoporosis, as well as incontinence. Cancer is also included, hearing and vision loss, osteoarthritis, insomnia, diabetes, depression, heart failure as well, frailty, and balance issues. So what is the difference between a gerontologist and a geriatrician? So, the gerontologists aren't medical doctors. However, they are professionals who specialize in issues of aging or professionals in various fields from dentistry and psychology to nursing and social work who study and may receive certification in gerontology. These professionals are prepared to provide their services and care to older adults. So, the geriatricians also tend to coordinate a team of health specialists like physiotherapists and occupational therapists that ensure the patient that they are in the best environment and are safe and supported in their social situation, whatever that might be. Gerontologic nursing is concerned with the assessment of the health and functional status of older adults, which they diagnose, plan, and implement healthcare and services to meet the identified needs of our client, and they also evaluate the effectiveness of such care. So this is the term that is most used by nurses, which specializes this field. For gerontic nursing, it is the nursing care to an older person. It is a compromise between geriatric nursing, which primarily focus on older individuals who are ill, and a gerontologic nursing, which a more holistic view of the nursing care of older persons. And for the geriatrics, it is the branch of medicine dealing with the physiological characteristics of aging and the diagnosis and treatment of diseases affecting the age of a person. And for the gerogogy, it is the teaching of older persons. Note, it is different from andragogy, which indicates for adults, and pedagogy, which is only term used for children. For teaching to be effective, gerogogy must be adapt to normal physical, cognitive, and psychosocial changes that occur at this phase of growth and development. So let's move on to another information about gerontologist nurse that will be discussed by Ms. Jorfeline Medrano.
Thank you, Mr. Guillermo. So moving on to the gerontologist nurse. Gerontological nursing is the aspect of gerontology that falls within the discipline of nursing and the scope of nursing practice. It involves nurses advocating for the health of older persons at all levels of prevention. Gerontological nurses work with healthy elderly persons in their communities, acutely ill elderly requiring hospitalization and treatment, and the chronically ill or disabled elderly in long-term care facilities, skilled care, home care, and hospice. The scope of practice for gerontological nursing includes all older adults from the time of old age until death. Before we move on to the roles of gerontological nurses, what does a gerontology nurse do? According to American Nurses Association, A goal of a gerontological nurse is to provide the highest quality care to older adults, and gerontological nurses focus on the process of aging and the protection, promotion, restoration, and optimization of health and functions. So moving forward to the roles of gerontological nurses, they are the provider of care, teacher, advocate, and research consumer. So for the first one, the provider of care, in the role of caregiver or provider of care, the gerontological nurse gives direct hands-on care to older adults in a variety of settings. Older adults often present with atypical symptoms that complicate diagnosis and treatment. Thus, the nurse as a care provider should be educated about the common disease process seen in the older population. Second is the teacher. Gerontological nurses focus their teaching on modifiable risk factors. Many diseases of aging can be prevented through lifestyle medication such as healthy diet, smoking cessation, appropriate weight maintenance, increased physical activity, and stress management. So the gerontological nurse provide health education to the older adult to modify the risk factor that aggravate their diseases. Third one is the advocate. As an advocate, the gerontological nurse acts on behalf of older adults to promote their best interests and strengthen their autonomy and decision making. Nurses may also advocate for patients through other activities such as helping family members choose the best nursing home for their loved one, or listening to family members vent their frustrations about health problems encountered. For the last one, which is the research consumer, this involves gerontological nurses being aware of current research literature, continuing to read and put into practice the results of reliable and valid studies. Using evidence-based can keep gerontological nurses improve the quality of patient care in all settings.
Occupational therapist. Occupational therapy is a process that involves helping people at all stages of life, from toddlers to elderly, develop, maintain, or recover the skills they need to daily activities, also known as occupations that are meaningful and necessary. The type of occupational therapy a person receives will vary greatly on their needs. Occupational therapists also educate and work with the patient's support system, like parents, caregivers, teachers, and etc., to make sure everyone understands their role in the patient's care program. And the following are the key benefits of occupational therapy for elderly. First is the keep arthritis at bay. An occupational therapist will properly analyze their patient to determine the type of arthritis and then take relevant action. Arthritis patients may feel pain and discomfort when moving the affected joints. Therapists will help patients by helping them use their hands differently or change their resting positions to more comfortable positions. This will allow them to perform heavier jobs with more ease. The use of affected joints in a different manner will also help them perform tasks with fewer resting breaks. Number 2 is increases movement range. One of the more common and helpful techniques used by therapists is a range of motion or ROM exercises. ROM exercises do exactly what the name suggests: increase the patient's range of motion while decreasing the pain and stiffness. This is particularly helpful in the case of elderly patients who have worn out their ligaments, have stiff joints, and are ill by arthritis. Next, number 3 is improves vision. Occupational therapists can help elderly people with eye conditions such as double vision, lazy eye, balance dizziness, strabismus, and reading. The therapist starts by identifying whether the damage is repairable or not, which they give the patient treatment tailored to their needs. Next is boost memory and cognitive skills. With age, it is common for the brain cells to deteriorate, leading to forgetfulness or dementia in severe cases. Occupational therapists can help patients retain and sharpen their memory and cognitive skills at any stage of memory loss. However, the earlier the treatment begins, the better. Solving crossword puzzles and reading books are prime examples of cognitive exercise. And the last one, number 5, is the helps coping with chronic pain. So chronic pain continues beyond its usefulness as a warning. It might be due to several factors, the most common of them being the normal aging of the affected bones and joints. Other causes include nerve damage, traumatic injuries, injuries that fail to heal properly, and etc. Chronic pain can result in loss of empowerment and control over daily activities. Occupational therapists use managed approaches to provide patients with adaptive ways of going about their daily tasks.
Next is for the physical therapist. Physical therapy can help seniors retain their independence, whether they are managing a long-term illness or just want to improve their general health and mobility. The goal of physical therapy is to help restore and improve functionality, reduce pain, and increase mobility for better strength and balance. Physical therapy for senior is beneficial for a variety of reasons, including number 1, reducing the risk of a fall. One of the most common reasons of a senior needs physical therapy is to recover from a fall. Falls are the leading cause of accidents among seniors and often results in bone fracture and other injuries. A physical therapist can teach senior techniques to prevent a fall. Second, lowering the risk of injury. Physical therapy helps seniors learn how to maintain their stability as it relates to the gravity when they're mobile. This awareness helps reduce the risk of injury and re-injury. Third, decreasing pain from chronic condition. Physical therapy can help alleviate discomfort from conditions like arthritis or osteoporosis and offset any future symptoms. Fourth, lessening the need for prescription drugs. Seniors are often on a wide variety of prescription drugs to help manage their chronic pain. However, a physical therapy regimen could help reduce the need for medication and could be more cost-effective form of treatment. And lastly, maintain an independent lifestyle. The quicker seniors can recover from an illness or an injury and manage their pain allows them to lead an active, independent lifestyle for a long period of time.
Speech therapies. Speech therapy for senior is often necessary when recovering from the debilitating consequences of a stroke or dementia. It may also be necessary after a head injury. The ability to communicate effectively is important at any age. But for seniors, it can be vital. If a senior cannot successfully describe what they need, where they hurt, or what is wrong in general, an emergency can easily occur, and speech therapy considered reasons such as the aphasia, second one is apraxia, third one is the dysphagia, and last is the dysarthria. So, first is aphasia. Aphasia is a communication disorder in which patients have trouble in finding the right word for their thoughts or their speech in halting or unclear. The speech therapy works to help the patients to concentrate to find the right word. The goal of the therapy is to have the patient reach the maximum possible functioning, although it may not be the same level as they enjoy before their stroke. Okay. Second one is the apraxia. Symptoms includes using word out of order or even having trouble moving their lips correctly to form the words. Treatment can involve asking the patient to repeat the certain words and then try to make sounds into words. Also, the patients may have to speak more slowly, at least at the first, to make the word or say them in the correct order. Okay. The dysphagia is the ability to swallow easily. A speech therapy may recommend a special position for eating certain foods or modified utensils to combat this problem. So, syempre, of course, ang mga stroke patients, nahihirapan silang lumunok ng kinakain nila. That's why, ang dysphagia, ito yung parang therapy na ginagawa for the stroke persons. Okay? And then, last one is the dysarthria. It is commonly seen in those with diseases that affect the nervous system, such as the Parkinson's disease, because of weakness of paralysis that are typical of the condition. Symptoms include a slow rate of speech or speech that sound mumbled, slurred, or hard to understand. In these cases, a speech therapist will often monitor the patient muscle and breathing, as well as have them repeat the certain words. There are treatment techniques often involved to the patient to work on the tongue and lip movements, breathing techniques, and speaking more slowly to have time to form words.
Gerontological nurses act as managers during everyday care as they balance the concerns of the patient, family nursing, and the rest of the interdisciplinary team. Nurse managers need to develop skills in staff coordination, time management, assertiveness, communication, and organization. Nurse managers may supervise other nursing personnel, including licensed practical nurses or LPNs, certified nursing assistant or CNAS, nurse technician, nursing students, and other unlicensed assisted personnel or UAP. Thank you.